Hi, I'm Marquita Little, Health Policy Director at Arkansas Advocates for Children and Family. And today I just want to give you an update on the latest in healthcare in Arkansas. Governor Asa Hutchinson recently announced several proposed changes to our Arkansas Works or Medicaid expansion program for low-income adults. And these issues will be the main purpose of May's special session. So the first change is proposing an eligibility cap on the program. Today, an individual who earns up to about $16,500 would be eligible for Arkansas Works. If this proposal were implemented, that cap would drop to about $12,000. A family of four who earns almost $34,000 a year currently qualifies for the program. If this proposal were implemented, that would reduce to no more than $25,000. So this means that about 60,000 individuals who are currently enrolled in Arkansas Works would no longer be eligible. The governor stated that the plan would be to transition these individuals to the health insurance marketplace. One of the biggest potential concerns with this proposal is our ability to actually successfully transition people to the marketplace, and it's also based on the assumption that they will be able to afford coverage comparable to what they have today at about the same price. The second proposed change to our Arkansas Works program is to implement work requirements. Earlier this year, the state implemented a new policy for individuals that were non-disabled and reported being unemployed to be referred for job training. Well, this new proposal would go a step further and actually make it a requirement for an individual to either be employed, meet one of the exemption requirements like being enrolled in college as a student, or they would have to participate in job training. We saw similar work requirements implemented in states after the federal 1996 welfare reform bill passed. And what we saw across the board was that these types of work requirements long-term did not lead to increased rates of employment. For people who were able to use the supports to seek out a job, these jobs are usually low paying and they don't lift people out of poverty. And there are two additional proposals on the table. One is to subsidize employer-sponsored insurance. Individuals who are working and currently eligible for Arkansas Works would have the option of enrolling in their employer's insurance plan, and the state would use the Medicaid dollars to help reduce the cost of that plan for the employer. And the final proposal is to give the state greater control over determining the eligibility of participants in the program. So up until this point, the state has relied on federal government systems to determine if someone actually meets the eligibility requirements when they apply for the program, and that information is sent to the state. This change would allow the state of Arkansas to actually make those determinations. And so while the final two proposed policy changes may not seem as concerning, it's important for us to keep in mind that these are additional restrictions on top of other changes that we've already made to the program. The state agencies have to keep up with those changes. They have to absorb the cost and handle the challenges that come along with rolling these new changes out and educating consumers. This special session will be incredibly important, because we are not only charting the course for the future of the healthcare system in Arkansas, but we're serving as an example to the entire country. So our next steps will be critical.